Hello and welcome to this special feature. Now, it's important to live a balanced life, and our health and well-being play a very important role in this. Every day we're warned about many devastating diseases, but at the end of the day, one of the deadliest is still heart disease, the number one cause of death in men and women worldwide, and more people die from heart diseases each year than all forms of cancer combined. Heart disease now doesn't occur in seniors only, it's also affecting younger adults more and more. And just what is more threatening? Well, heart disease can cause death instantly, and the main reason for heart-related deaths is a lack of awareness about what to do in a cardiac emergency. Now, educating people about the signs of a heart attack and a cardiac arrest and the importance of taking immediate action can improve survival and minimize the damage that can occur during a heart attack or a cardiac arrest. Well, as always, we're joined by medical experts to take us through all the details we need to know to increase our awareness and about life-saving techniques like cardiopulmonary resuscitation. This program, Save a Life, is an initiative to make people aware of the early signs and symptoms of cardiac arrest. Joining us today, Dr. Kapil Dev Doomra, consultant cardiologist with the CARE Heart Centre in Chandigarh. We're also being joined by Dr. RusheeKanta Mohanta, who's a consultant cardiologist with the HeartMate Institute in Cuttack, and Dr. Soumya Kanti Dutta, interventional cardiologist with SSKM IPGMER, Kolkata. Thank you all for being with us. Let me begin with Dr. Doomra. We always talk about chest pain as a symptom, and we're sort of used to seeing scenes in films where people clutch their chest when having a heart attack. But in your opinion, what are the indications that are worth looking out for to schedule an appointment perhaps with a doctor or to sort of do regular checkups? Are there any warning signs leading up to a possible heart attack? Dr. Doomra?
Yes. There is a huge burden of cardiovascular diseases in India. So symptoms basically are shortness of breath, chest pain, on exertion, and palpitations. But sometimes symptoms are very vague. Suppose in elderly patient is just having unexplained tiredness, patient is having feverish feeling, and patient is having on echo patient diagnosed as a patient of heart failure with decreased pumping capacity of heart. And in inferior MI, that is a type of heart attack, symptoms are also vague. Patient is just having stomach pain with the nausea, vomiting, and lightheadedness. And on the ECG, there is a huge heart attack. Common symptoms, suppose patient is giving history, activity, patient is doing a walk for about 3 minutes, but now during that activity, patient is having palpitations, pain, or dyspnea, that is shortness of breath. Then you should consult doctor immediately. There may be a heart problem.
Dr. Mohanta, if I can bring you in now, what are some of the most common risk factors associated with cardiac disease in general and heart attacks in particular? Dr. Mohanta?
Most common risk factors associated with cardiac disease in general and heart attack in particular may be divided into two parts. One is modifiable risk factor, another is non-modifiable risk factors. Increasing age, male gender, heredity, and race are the risk factors of heart disease which cannot be modified. Modifiable risk factors are those that can be reduced or controlled with altered behavior and lifestyle changes. The risk that smokers will develop coronary heart disease is much higher than that for non-smokers. As our blood cholesterol rises, so does the risk of coronary heart disease also increases. High blood pressure increases heart's workload, causing heart muscle to thicken and become stiffer. An inactive lifestyle is a major risk factor for coronary heart disease. People who have excess body fat, especially if a lot of it is at the waist, are more likely to develop heart disease and stroke.
Now, Dr. Datta, some people can get a mild heart attack. What do we mean by a mild heart attack? Is it a warning sign? What is the difference between a mild and a severe heart attack?
Okay, so there is no term called mild or severe heart attack, So any heart attack is a deadly condition, is a life-threatening condition. So there is no dictum that you may have a mild heart attack or severe heart attack. But there are some pre-monitoring symptoms that would suggest that you are going to have some heart attacks, that are effort intolerance or any kind of head drilling or syncope like phenomenon, heaviness over the chest, and the most important thing is the chest pain one walking or doing upstairs or any kind of doing jobs. So there is no term called mild heart attack. We all should know that any kind of symptoms that is having the shortness of breath or chest pain, we should consult our doctors immediately because these are life-threatening conditions.
Yeah. Dr. Doomra, globally, it seems cardiac arrests now claim more lives than all kinds of cancers put together, influenza, pneumonia. Why are the chances of dying on the spot due to a cardiac arrest so much higher?
Sudden cardiac arrest means your heart suddenly stops beating. And there is difference between the heart attack and sudden cardiac arrest. Sudden cardiac arrest may be problematic, and it is basically when your heart is deprived, is pumping, not pumping well, it just suddenly stops, and then each and every cell and organ is deprived of oxygen. So it can prove fatal within seconds, within minutes. However, survival odds are best when help is immediate. So if the bystander is good enough to just give a good CPR, then patient can be saved. So everybody should have information regarding this.
Right. Dr. Mohanta, most people still don't really understand the distinction between a heart attack and a sudden cardiac arrest. Is there a distinction? Are there differences in symptoms? How does one know if it's a primary cardiac arrest? Dr. Mohanta?
Primary cardiac arrest recognized by a sudden, unexpected, witnessed collapse in an individual who is not responsive. Patient with primary cardiac arrest often gasp, which provides adequate ventilation but indicates a cardiac arrest. If not treated immediately, sudden cardiac arrest can lead to death. If someone experiences cardiac arrest, they need immediate treatment to increase the flow of oxygen-rich blood to different organs.
All right. Dr. Dutta, what are the correct steps to follow when one is on the scene where a person has collapsed?
Yes. So all we have to serve as a doctors. That means D stands for dangers. Whenever you stand in the scene, there is a danger, your immediate response should be the response. So R stands for response and shout. So we should call for an ambulance and we should start the CPR, that is the cardiopulmonary resuscitation, which should be learned to all, because this is the most important thing, that any person who collapses, and we can take this person to the hospital immediately by doing the cardiopulmonary resuscitation. So immediate steps should be to secure his breathing, and the most important thing by the chest compression, adequate chest compression, which is the 5 centimeter depression of the chest that leads to ultimately preservation of the circulation. So these three important steps, A, B, C, that means airway, breathing and circulation, helps us to survive until the patient is carried to the nearby hospital.
Right. Dr. Doomra, CPR, of course, is a life-saving technique, but what exactly happens during CPR? If you can just help us understand how it helps.
CPR is basically cardiopulmonary resuscitation. So it is a technique to keep the blood flowing throughout the body by artificially pumping. So in this technique, basically one hand is placed over the center of chest, that is the heel of the hand, and the other hand over the top of it with the fingers locked. Then with the heel of the first hand, we have to, keeping the arm straight, you have to just compress the central bone of the body to firmly, so that it is compressed between about 4 to 5 centimeters, and then it will keep that circulation maintained. So what would be the rate of that compressions? That is approximately 3 per second. So it is really helpful to just salvage the myocardium and keep the body.
All right. Thanks very much for that response. We will take a quick break, but there's lots more to talk about. We'll be back in just a moment. Welcome back to Save a Life. We've been talking to medical experts about cardiac arrests and life-saving techniques. Dr. Mohanta, if I can come to you now, what precautions should existing heart patients take when they're traveling?
Actually, three most frequently asked questions when a patient gets discharged from any surgical or cardiological intervention from a hospital that we come across in day-to-day life. One is what to eat, how much exercise to do, and whether he can travel safely or not. These are three most frequently asked questions by a patient to us. So most cardiac patients can travel safely, and most of the time a patient having some device implantation like pacemaker, they are worried whether they can pass through the security scan in an airport or not. But most cardiac patients can travel safely. And before traveling, any cardiac patient, those who are undergone any procedure or cardiological intervention, they should plan for an appointment with their doctor to ensure that they are physically fit for the activities they are planning. Always keep medication in its original packaging and bring a letter from your doctor prescribing health condition and why you need this medication, because we have to produce this medication and the prescription as well whenever required, and that's why original packaging is also necessary. And choose activities that are appropriate for your health and fitness level, because all the patients are not fit to do all the exercises. Some patients having different functional classes, some may be requiring bed rest, some may be requiring home exercises, some may be fit for sports also. But we have to choose and take the opinion of our consultant or the treating physician about the activities that is appropriate for their health, and avoid extremely hot or cold environments and destination with heavy air pollution, all of which can put stress on your heart.
Right. Dr. Datta, how important is it that people whose relatives suffer from heart disease learn to give CPR? Would you recommend it?
Yes. Yes. It is extremely important to learn CPR for not only those of having relatives, be it a first degree or second degree relatives or any family history of cardiac diseases. But what I think CPR should be a part of the learning strategies from all schools and colleges, because it is the only step that can save our life in emergencies. So definitely it is important for the relatives, those who have survived cardiac arrest, those who are having patients of heart diseases like coronary artery disease or any kind of valvular disease or any kind of cardiomyopathies. But definitely it is important to learn for all of us, not only the CPR but also the defibrillation strategies as well, because it is the only thing that helps us in emergency to save lives, to reach our nearby hospital, and that is the only thing that we can serve as a doctor being a normal person. So any person, whether in the railway station, in nearby market, everyone, if knows the steps of CPR, it is easier to save everyone's life.
Right. Now, smoking, of course, is one of the main risk factors for heart diseases. Dr. Doomra, if a person who's been smoking for a long time stops smoking, will their risk of heart attacks be reduced, or is there a cumulative effect that doesn't go away even if you quit?
I think it is crystal clear. Smoking is always bad, and it is injurious to our heart, and it can lead to so many cancers like lung cancer, bladder cancer. So if a person who is smoking and he has been not smoking for the last 1 year, the risk of having heart disease is almost half, and you can quit smoking at any time. One thing is, suppose you are having a history of coronary artery disease and you have just history of coronary artery bypass surgery or stenting for that, and you still smoke, then it can lead to blockage of that stents and blockage of that grafts. And also it can lead to decreased pumping capacity of heart, that is called cardiomyopathy, and it also one of the common causes of heart attack in young people.
Right. Dr. Mohanty, this goes back to a question I asked earlier also, that the symptom of a heart attack in, common acceptance is severe chest pain. But is that the only symptom, or are there other things we need to look out for? Dr. Mohanta?
Most common cause is chest pain that we know, but sometimes a patient may have painless heart attack. So mostly it is seen in patient with chronic uncontrolled diabetes mellitus, in which in addition to the cardiovascular system, it also affects the nervous system, where the pain transmitting nerves are also affected. So they cannot, the brain cannot sense the pain sensation, and some patient can have painless heart attack also. So symptoms of heart attack may vary. The severity of symptoms varies from person to person, and the type of symptoms also varies from person to person. Chest pain may feel like pressure, tightness, pain, squeezing, or aching is the most common symptom of heart attack. It can feel as if pain is spreading from your chest to your arms, jaw, neck, and tummy. Pain can be felt from jaw to the umbilicus. This is the region where pain is felt. It may radiate to the left side of the heart, also to the right side of the heart.
All right.
Other heart attack symptoms may include feeling lightheadedness,
Yes.
sweating, shortness of breath, easy fatigability, nausea, and vomiting.
Right.
You can feel as if pain is spreading from your chest to your arms.
Yeah.
And these are symptoms that is present in varied manner in a varied person.
Okay. All right, Dr. Mohanta, thank you. That's a very comprehensive answer. But Dr. Datta, people with heart disease are always worried when they exercise. There is this misconception that they could put more strain on their heart. Now, are there any recommendations about how much exercise, what form of exercise, Dr. Datta?
Yeah, definitely. There are recommendations for cardiac patients of exercise. First thing, we should follow that aerobic exercise should be performed. We should not perform indoor exercise or in a gym or lifting heavy weights. These are to some extent contraindicated in patients with cardiac diseases. But definitely brisk walking in the field or open air is definitely helpful, and any cardiac disease patients who have survived from cardiac arrest also, they can perform brisk walking or even small jogging freehand exercise for at least 30 minutes a day, and it should be done, and it's recommended for at least 5 days in a week. So definitely moderate exercise, aerobic in the open air fields are recommended to improve your cardiac capacity, to improve your cardiac elements. Definitely it reduces blood pressure, it reduces blood sugar, and definitely the chances of recurrence of cardiac events is definitely reduced with exercise.
So, Dr. Datta, let me just ask you, what about yoga? Is that a good thing? Would you recommend yoga?
Yeah, it is extremely helpful, because the most important thing that yoga helps us is to diminish our sympathetic overactivity. So any kind of cardiac disease is precipitated by the sympathetic overactivity, which increases our heart rate. So yoga, what it does, it reduces our heart rate, our mind becomes cool and calm. So definitely it not only improves the heart rate, it not only improves the oxygenation within the heart, but definitely it improves the overall generalized circulation from brain to the lower extremities. So yoga is extremely a good thing, and it was invented in India in very long back, and it is the most important thing that can save our life even before, after starting from the 8 years to 80. So yoga is extremely important and helpful in all cardiac patients.
All right. Dr. Doomra, what types of food should one eat to avoid or perhaps better manage cardiovascular diseases? Is there any specific food that you would recommend?
Well, if the patient is already having heart problem, then that does not matter. Depending on the risk factors, suppose patient is diabetic, then you should be on the diabetic diet. It should be that is in the low in calories, high protein diet, that should be low in the saturated fats. However, omega-3, omega-6 fatty acids really they are good for heart, and for that purpose, fish is good for heart.
Right. What about, Dr. Mohanta, if you'd like to take this, people who survive one heart attack, could they be at high risk for another, and what precautions can they take to try and reduce the chances of a second heart attack?
If a patient suffers from one heart attack, immediate steps should be taken to prevent further damage of the myocardium, and so that the ejection fraction of the heart, that is the pumping function of the heart, should be minimally affected. Once a person is affected with some cardiac event, mainly the parameter that is affected is the ejection fraction, that is pumping function of the heart is affected. So once it is affected, the quality of life and the exercising capacity, everything that reduces. So our aim in the future, we should avoid a second attack by minimizing the risk factors that we are having previously, like diabetes. We should control the diabetes to the best possible level. We should control the blood pressure. We should control the cholesterol level, that is LDL cholesterol, which is called the bad cholesterol. It should be as low as possible. Minimum it should be less than 70, and there is no lower limit. We can go as below as possible. More the lower the cholesterol level, LDL cholesterol level, we will have more the benefit. So if we control the risk factors, we can prevent the future cardiac event or coronary artery disease.
All right. Thanks all very much indeed for joining us on this program today and sharing your expert views. And of course, on this Save the Life initiative, we're going to keep talking about the importance of responding to symptoms and indeed knowing life-saving techniques. Thank you all and thanks for watching.